I call the member for Wollondilly.
Thank you, Speaker. Before I go on with my speech, I'd like to congratulate the member for Camden. Her and I share Wire Lane in the Camden area, and to get the money and the lights there is so important. My own electoral officer was hit there, and we know we've lost lives there, so congratulations and well done. So Wollondilly, on another note, faces a distinct shortage of local and state medical infrastructure, including diagnostic testing, specialist cancer treatment and emergency departments. I know I represent both Wollondilly and Wingecarribee. The Wollondilly Shire LGA could literally be the only local government area in the Sydney metro area that does not have a public or private hospital. What is little appreciated by the government is that the nearest hospital and lack of after-hours medical services in Wollondilly result in travelling roughly 30 to 80 kilometres on rural roads and major highways to major regional hubs like Campbelltown, Nepean and Bowral hospitals for emergency, specialist and acute hospital care. Access to care is fraught with traffic congestions in peak commuter times where patients share the road with freight movements and commuters travel through the Electorate, and they travel to places like Canberra, Wollongong, Campbelltown, Liverpool, Penrith and Parramatta. The Electorate is known to have fewer overall GPs, long wait times and noticeable lack of female practitioners or after-hours medical options, and unreliable public transport to even get there. All these factors cause symptoms in the health system such as long wait lists, waiting times in emergency departments, high chronic disease rates compared to Greater Sydney averages, and toll of road travel on sick patients. In addition to the limited and unreliable public bus and rail transport, Wollondilly in the Southern Highlands has a drought of taxi and shared transport options. You can simply stand there and order a taxi and nobody comes. Public transport options are limited at best of times. We've got the slowest and the most unreliable train service, let alone the moments when residents are ill or in need of urgent care. Furthermore, the Wollondilly Shire and Southern Highlands region is home to the beautiful national parks and nature reserves, and which we love, and we've just got a new national park on the northern end in the Wollondilly Electorate. But visitors come to our scenic natural environment and open space, and each year, particularly in the hot summer season, emergency services are called to popular swimming spots such as mermaid pools in Tamor to winch and rescue injured locals and visitors from natural areas by helicopter and paramedics. But they have to travel a long way to actually get some hospital service for them. There's clearly an us and them contrast between Wollondilly and the rest of Sydney Metro. After more than 15 years of state government infrastructure neglect, Wollondilly needs its own urgent care, integrated primary health care and hospital infrastructure. Health services are needed to support the existing residents of all ages and support the planned growth of the region to support homes and jobs in the area. In the past 3 years, the New South Wales Government has started to listen to the needs of Wollondilly community. I support new housing in well-located areas, and the government must support and complement rather than prioritise housing development over social infrastructure and health infrastructure. Across the Electorate, residents are physically isolated, burdened by length of time to travel from hospitals and the lack of other options, facing barriers including finding parking and securing a bed at any hospital there. Whilst I support the New South Wales Government rollout of urgent care services in New South Wales to help reduce pressure on emergency departments, I am disappointed that New South Wales Health and the local health district has not prioritised any urgent care clinics in Wollondilly or the Southern Highlands. The pressure on Wollondilly households to transport sick family members, lack of GPs and medical centres open late hours or weekends puts avoidance pressure on the New South Wales ambulance system to call out paramedics to Wollondilly and then on to the nearest hospital 30 to 80 kilometres away, and it's diabolical. I note that in the last week there's been times when 28 of the 50 beds in Bowral Hospital actually filled by people waiting to transition, so there is no space even when you get there. I advocate to the New South Wales Government to commence business cases to deliver multiple urgent care services in Wollondilly and the Southern Highlands, similar to those that have been introduced in other Sydney Metro and Illawarra, to help reduce transport costs and time pressures on Wollondilly-based patients accessing diagnostic equipment, including X-ray pathology, alleviating the dire conditions in emergency departments exacerbated by the geographical inequality of living in a peri-urban area.